When you go home, we find that's often a time when people will actually begin to develop what we would call a clinical depression. You're isolated from the hospital, you've had lots of support while you're in hospital. You'll notice that the fatigue is starting to get worse. You're losing interest in things. You don't want to participate. And it's very, very common for people with head and neck cancers. They're one of the highest levels of cancers that develop a depression afterwards. And that relates to a lot to the change in body image. You often look very different in your face. You might be missing an eye or an ear. That's a difficult thing to cope with, and I often worry more about the people that don't develop a depression. It's normal to respond in that way. There are plenty of opportunities for you to help yourself in this circumstance, going to support groups, talking to other people, that have been through the same situation, coming and seeing the psychologist, and we're still happy to see people as outpatients once you've gone home from hospital, talking to your GP, talking to your care coordinator. Try and access the services, but again, talking is the most important thing, and recognising it's normal to struggle with this. It's a really difficult time.
Personally, I think men hide things better than women. Women seem to be able to let it go, whereas men, I think, internalise it more than speaking about it. And I've found since I've had the operation, I'm more prepared to talk about it now. Maybe I was lucky. I had some really good friends that I could speak to about anything before and after the operation, including all the doctors and the nurses.
You will get through it, with the support and tapping into all of those resources. There is an end point, and people do get used to living with these changes in their lives. I've seen a lot of patients over the last 10 years who've had to struggle with these changes, and they do get there. It might take 4 or 5 years before you begin to feel confident again, but you will feel confident and you will be able to get back into your life and live the new normal.